Thank you, Dr. Ayush Sharma, for having me for this conference. I apologize that I can't be present in person, although I would have loved to be there around the entire day. I hope you had a good time today. So my topic is how to make an effective scientific presentation. Now, I don't want to give you a lecture on how to make an effective presentation or an effective PPT, but I want to tell you a little bit about how to make a scientific presentation also. Most of you must have already done a few scientific talks either in conferences or as a part of a teaching program. And I think learning to give such talks effectively is more of an art rather than a matter of learning technology or some software. What I will cover is basically the design of a talk, the structure, and lastly, we'll end with a few PowerPoint tips. Now, there are three pillars on which the design of your talk will rest on: the audience, the environment, and the message. Let's see one by one. First, know your audience. Is the audience a mixed bag of doctors with different specialities? Or is it a group of orthopedic surgeons? Or is it a group of spine surgeons like yourself? Are you presenting to an audience of experts, of peers, or trainees? The presentation will differ for each type of audience. So you need to take an effort to know your audience. Ask yourself a question: what do they expect to learn from this presentation? And how is it going to be useful for them? Impressing people is utterly different from being truly impressive. If you keep this in mind, then your audience is more likely to appreciate your talk than a presentation that is intended to impress the audience by glorifying your accomplishments. Next is, where are you presenting? Is it a large conference hall or a small conference room? How is the lighting? How is the projector? Are they going to allow Mac keynotes or Microsoft PowerPoints? And sometimes such things are difficult to anticipate or predict too far in advance, but we should always make an effort to do so and finding out these things. And the third is, what is your primary message? Because your whole talk will revolve around a purpose. And that may be an idea or a concept that you want to convey, or an important finding that your research uncovered, which you want your audience to know. And this needs to be absolutely crystal clear in your mind. Now, coming to the second part, which is the structure. Indicate the scope of your presentation with an informative title. Do not use humor or catchy wordplay, because if the title does not convey what you are going to speak about, the audience will not be interested in it. It is always polite in the beginning to acknowledge your co authors, and most scientific meetings would require you to disclose your conflict of interest. So, here be honest. And for me, I can say that I don't have any disclosures that are relevant to the topic that I am speaking on, so that you can go forward quickly. Most of you know the structure of scientific presentations, which is the IMRAD format. It begins with an introduction, then its material methods, results, and then finally discussion. The introduction has to zoom in the topic. The introduction is something where you are presenting in 2 or 3 slides, where you are describing what we know about the problem at hand. Then the next slide is what we don't know about it. And the final one would be why you did this study, which will be the aim of your presentation. So if in the first 3 slides you cannot zoom into your topic, then you will waste a lot of time in the beginning of your talk. Tell a story to begin with. A story introduces your topic or question and makes the whole presentation interesting. It captures the attention of the audience. Don't cram everything. You can't possibly say everything in your thesis or your project in 4 minutes, which is usually the time given to you to present. Present only what is relevant and stress only on the important points. All the points should contribute to your underlying message. By recognizing the limitations of your experiments and clearly defining the conditions under which your conclusions are valid, you gain respect and credibility of your audience. So stand back and critically examine your own work for shortcomings. You need to own them up front. And finally, the conclusion or the take home messages. Present the big picture. That's the zooming out of the presentation. How your findings contribute and further the understanding of the subject. The last slide always should not be a thank you slide. It should be a summary slide in which you are giving few basic take home messages that you want the audience to remember. Finally, the third part of my talk, which is PowerPoint tips. And essentially, this is about how to use PowerPoint features effectively, but also you should remember how not to use them. You don't want to impress your audience with PowerPoint skills and technology skills. The audience should appreciate your content more than your PPT. So for me, I follow the KISS principle, which is keep it simple, silly. You want to keep the background black without any adornments. Most rooms where you will be presenting will be dark. The lightings will be lower. And remember, contrast is your friend. In a dark room, you don't want to blind people with a bright white light. You should shine more than the computer screen or the projector screen. Moreover, because most of our presentations will have X-rays and MRIs that are black and white, they go really well with a plain black background. If you are going to be in a brightly lit room, then it's okay to use a light colored backdrop, white or a blue background. But remember that if you are in a dark environment or the light is low, then best is to use a darker background with lighter letterings. Always choose a sans serif font. A sans serif font is a font which doesn't have those expansions at the end of the lettering. And this is because it is easier to read a sans serif font. Always use a very simple font, and a common one is Helvetica. It always looks good. It is a standard default font. So don't try to change your fonts into fancy fonts, because if you are going to switch from one computer to the another, and if that other computer doesn't have that fancy font, then your presentation is going to look different. So always choose either Arial or Helvetica. They always look good, and they are always installed on every single computer, whether they are Macs or PowerPoint or Microsoft. Make your font big enough because your audience should be able to read it. The last three lines are 42 size, 58 size, and 70 size, and you can make out the difference that the people sitting in the back row should be able to understand or read those lines. This is the most common layout that people use. This is the bullet point layout. But what I would encourage people is not to start with this default bullet point layout. Start with a completely blank screen, because the blank screen lets you think how you want to convey your idea. Some people consider bullet points like speaker notes, an outline to help jog their memory about talking points. PowerPoint is not your teleprompter. It is a visual aid for your audience and not for you. So if you find yourself putting up bullet points so that you won't forget what to say, you are doing your audience a disservice. Do you recognize this? Slides with multiple paragraphs of text that have shown to significantly decrease the attention of the audience, and thus the effectiveness of getting your message across. Don't do what I'm doing right now. Since we can't read and listen at the same time, this basically tells the audience to read directly off the slides and stop listening to you. Even worse is to type in capitals and then read it out, because this is terrible to read. This does not mean that all bullet points are bad, but like other design elements like color, it can be overused. A common error is to overuse the popular 166 rule, that there should be one idea per slide, and in general having one idea per slide is a good thing. But the other 2 points, that you should have no more than 6 bullet points per slide and no more than 6 words per bullet, this rule is a completely made up rule, but it is a very popular rule, but it is rubbish. Because anytime you use a layout over and over again, people will eventually stop paying attention, and psychologists call this habituation. So if you are using slide after slide that are just bullet points, people are going to switch off very quickly. So then when do we use bullets? For that you need to understand what bullets are. Bullets are basically lists. So imagine where lists would be used. Lists would be used if you have something chronological to convey, or if you have something in an order of importance that you want to convey, or is just a group of a particular cohort that you want to group together, right? Now coming to figures, you can see this picture. When I present this picture, this is a very busy figure because you don't know what to look at. Should you be reading the numbers, or should you be reading the Rickenbacker 1964, or should you be reading the dorsal to the posterior arch of Atlas? So even before I start speaking about this picture, the attention is going on things that I don't want you to pay attention on. So give yourself some time to prepare your images very well. They should be clean, without any clutter. You should try to remove the background and labeling as much as possible. Let's say for this example, I just want to convey how the course of the vertebral artery is above the above the C1 posterior arch, and that's the only thing that you need to focus on here. And I've removed all the miscellaneous things around it, so it makes your image stand out and more effective. Again, very common mistake is when you are putting up X-rays or MRIs on your slides, and you don't make them into grayscale. So whenever you take photographs on your phone of images, they have this bluish tinge in it, and that is not very appealing. But when you change it to black and white and blow them up, you can make the images look very good, and they appear in good contrast. So always do that for all your images. There's no need to tell that you should de-identify all your patients. And coming to tables, and this is a very common mistake people do, is just they screenshot tables and put it up in their presentation. It is impossible to understand this table in a few seconds that you have on this slide to speak on. So instead of that, take some effort to convert tables into graphs or charts and simplify them as much as possible. Use arrows and animation to point a specific aspect of the chart or a graph, and precision of these may be sacrificed for brevity, but that you want to convey a message. Definitely don't use weird clip arts, random word art. Use 5 different types of animations, and don't use any transitions at all. You can see I have not used a single transition in my slides. Also, rehearse and rehearse. No matter how experienced you are, it is good idea to rehearse. Either you do it in front of an honest, perceptive colleague, or record your voice on your phone and play it back. You will be able to identify flaws and correct them. Another important reason to rehearse is to practice delivering the talk within the time limit, because overshooting time is an unforgivable sin. I cannot stress this enough. It reflects poorly on the speaker if he or she is exceeding the allocated time. And that's exactly 15 minutes for me to give you this talk, and I have completed it. This is my last slide. After preparing and rehearsing, relax and chill. If your conference is in Goa, go to the beach, chill out. Nervousness before the presentation is a sure shot recipe for disaster on the podium. If you are nervous, write down what you are going to speak for the first few slides on a piece of paper and then read it out verbatim. Not too fast, just start slowly and thoughtfully. And this single trick has been really helpful for me. I don't need to tell you to dress appropriately. And finally, always end your talks with a conclusion and not a thank you slide. Thank you very much.